And here we go. So I am pleased to join you today. My name is Sarah Coleman, and I am the State Expansion Director at Healthy Birthday. We are an organization based out of Iowa, and it is a pleasure for us today to come and talk about the work that is being done in Minnesota. And we're joined by some special guests today, one of whom I'll let her introduce herself is Amanda Duffy. Amanda, would you like to say hello?
Sure. Hello, everybody. My name is Amanda Duffy, and I am the one of the Minnesota Count the Kicks ambassadors, and I'll be presenting today and talking a little bit about my daughter Reese.
Thank you, Amanda, for being here. I just want to acknowledge, we're also joined by Amanda Feltman in the webinar. She's a participant, and we'll also be sharing a little bit about how Amanda advanced helped to advance legislation alongside of Amanda. So a special shout out to her. And then Senator Pa is here joining us, and I'd love for her to just take a minute about introducing herself and telling her why she believes in Count the Cake. Senator, thank you for joining us. Oh, I think you're muted. I think you're muted.
Thank you. I forgot to unmute myself. Hi, everyone. Senator Susan Pa here. I had the great honor of chief authoring the bill that put together this pilot here in the state of Minnesota. It is an amazing program. And myself, as someone who has used the Count the Kicks app, can attest that it is something that every single woman should have in their toolbox as they're going through pregnancy. I've had the honor to be able to work with a great team here to get this passed, and I believe that this is a great opportunity for us to get this and expanded here in Minnesota. There are many ways that you could have spent your day today, but I appreciate that many of you decided to join us and spend some time to learn a little bit more about Count the Kicks. Um, Amanda, do you have some of the numbers from Minnesota or across the state that you could share with us? I don't have
We
that in
do.
front of me, but I'm excited about it.
I can actually put that up in front of you, Senator Paul, on the
Great.
screen. Yeah.
So Minnesota is 344 babies a year on average. We lose that to stillbirth. And then 5.35% in Minnesota. That is a huge percentage of their life, of the births that we have here. 110, we believe, count the kicks can save. And that's 110 babies, 110 families that would be impacted by this. That is incredible. I I think anything that can save one life is incredible, but the fact that we can save 110, that's why this is so important. And I'm proud to be a part of this work, and I'm proud to be here with all of you today. And looking forward to this presentation.
Thank you so much. We are delighted that you're here to join us and delighted that you're a Count the Kicks app user who speaks from that experience. We look forward to you chiming in if you would like to share more about that later in the presentation. So, as we move forward, I want to just share with you when we're talking about Count the Kicks, this is a highly effective evidence-based program. So, in the state of Iowa, what we have seen since the inception of the Count the Kicks campaign is a reduction in the stillbirth rate of over 32%. And that is the stillbirth rate across the board. When we start to look at different populations, we've seen over 39% decrease in the Black stillbirth rate in Iowa. So, what we want to do, we want to use that evidence and we want to replicate that campaign as we go into other states. In particular, we're talking about Minnesota today. So, this is known as an early warning system for moms. And as the spotlight in maternal health care has really turned to maternal mortality and morbidity, we're very cognizant that not when we have a reduction in movement or we have a change in the strength of movement or movement speed up, change in some way that that pattern has been established, what we know is that mom is usually the one who's going to start showing some signs, and we need to pay attention attention to her health. So we have saved lives in over 37 states and 6 countries so far. We'll talk a little bit about what we term a baby save. And I do want to acknowledge right here today, especially as we are talking about Reese's story, as Amanda's going to introduce her daughter, we want you to prioritize your well-being. We will share stories of loss. We will also share what we call baby saves. And these numbers are very real for us. When we look at the numbers, and we think about the populations that are most impacted by stillbirth and maternal morbidity and mortality. What we know is that there are disparities that show up across this, right? So when we take a look, there's some numbers and information on your screen in front of you. I won't read that out, but we know that when we look at Native American populations, when we look at Black populations, when we look at Hispanic populations, there are higher incidences of stillbirth. This is the case as we also look at other populations that we see that there's huge disparities of impact. And when we also think about the priorities that fall in healthcare systems, not all the time are we responding to concerns that people bring up themselves. So one other thing that I want to bring up when we're talking about Minnesota is rurality. As we consider that much of the state is rural and may have a longer time to access maternal health care, this is a consideration that we need to have as well. When it comes to rural settings, it doesn't matter about your income or anything like that. Rural settings lead to higher morbidity and mortality in general when we're talking about pregnancy because of that access. Also noting when it comes to access that across the country, and this is certainly true in Minnesota, we've seen less workforce related to obstetrics and gynecology, and this has a huge impact. So when we look at birthing centers closing across the state, oftentimes then you have a higher pressure on the centers that do have OBGYN staff and do have the ability to do emergent deliveries. They have higher pressure on them because they're seeing more patients. And so this is something to be very cognizant of. But the numbers are not inevitable. As I said, going back to frame this up, we know that when we have an opportunity to provide education, that as we're working alongside communities, we can have an impact and we can help in those communities take a look at what is happening, the education that is being taught, the community support that's being pushed around maternal people who deliver babies. We can look at that and we can say, where can we stand in those gaps? So this is really important as we're talking about this today to kind of understand and frame that. And as Senator Pa shared these numbers with you, again, this is not inevitable, but these are real people. These are babies that are not with us. When we look at that 110 number that we can save, those are babies that wouldn't be here otherwise. And so every life matters. And I think that was underscored as well. Every life matters. So as we're thinking about this today, I want to put two faces in front of you. This is baby Pippa and baby William. And these are babies that are here today because their parents were educated about Count the Kicks and because their parents were paying attention and knew that there was something different about the movement that was occurring with their baby. They were able to speak up to their provider. They were able to be seen for care. And as a result, Pippa and William are with us here today. And as Amanda says, baby saves are our goal, but also acknowledging that there are babies that are not here with us today. And we want to make a change in that. I also want to say really quickly, it's not a slide that's here, but before I start talking about the research, not all stillbirth is preventable, right? We do not understand all of the causes about stillbirth. We know that there are some things that are correlated with stillbirth, and sometimes we can look at an autopsy and understand why it happened, but other times we can't. Our goal today is to increase this campaign to increase the number of people who are paying attention to movement. When we pay attention to movement, and this is the nurse in me speaking, When we're paying attention to movement, we can have an impact on folks that identify something is wrong and seek care as long as their providers are listening to them. But if they don't understand those regular patterns, they may not even know to access care, right? So our goal here is that we get more people paying attention to fetal movement and understand how to access care. So, what are we based on? Let me take a step back. We talked a little bit about the success that we've had in Iowa. So, we are based on something that is called the Norway study. And how we came to be is that there were 5 women in the community of Des Moines, Iowa, that all suffered a stillbirth. And when they came together, what they determined in their words was they did not want anyone to join their club. They wanted to do something about this. And in particular, we have a story that is shared on our websites where one of our founders, Tiffin Yeaman, talks about how if she had only known to be paying attention to movement, she was actually seen for concerns. But if she had only known to be paying attention to this pattern, she believes her daughter would be here today. That is what our study is founded on. These women went out, they were looking for an opportunity to kind of broaden the education, but to standardize the education. And that's a big goal for us is we want everybody doing the same thing in response to fetal movement concerns, right? So in Norway, one of these researchers that circled here sits on our medical advisory board, but this team got together and they taught a group of pregnant individuals to count every day. They wanted them to notice what was happening with the pregnancy. They wanted them to count at the same time every single day in that 3rd trimester. And they were told, hey, journal it. And if you notice a change, we want you to come on in and be seen by OB. We want to evaluate and make sure nothing's wrong and intervene if necessary. So, what they saw as a result of this study, when they looked at the cohorts in general, they had a 30% reduction in the cohort that was paying attention to movement. That is significant. And that is the work and that is being done in Iowa. And that's also the experience that we've had. I told you that number of over 32%, right? We've had such success with this campaign. So, I just wanted you to have that foundation. We're also ACOG aligned. And when I say we're evidence-based, we have been published in peer-reviewed literature. That's really a key thing. It's not just someone writing an opinion or writing an article. This is peer-reviewed research. So really important distinction. And when we send out a follow-up email, I will send you an email that has a link to this research if you're interested in it. We'll also talk about another opportunity to learn more about the research about Count the Kicks later in the webinar. And please know that the slide deck is going to be shared with you as well. So this is something to move forward on. So I want to turn it over to Amanda. I'd like for Amanda to be able to share a little bit more about her story. So let me queue up. There we go, Amanda.
All right. So this is my daughter, Reese. Reese was stillborn 16 hours before her scheduled delivery on November 2nd of 2014. Leading up to her delivery, she was my second, and I had never once been educated on stillbirth as a risk factor, the importance of tracking her movement in the 3rd trimester. I didn't know I should be doing it or that it could be an indicator of distress. But it wasn't until after she was stillborn that I learned that sometimes the first and only indicator of fetal distress is a change in baby's movements. And I had noticed her movements becoming weaker as I got closer to delivery. I even expressed my concerns to my provider at around 37 weeks, but hadn't been tracking and just it was more of just like a feeling or something was off. And was told that, it's normal, babies, their movements get less as they run out of room, that I should just try to enjoy the last few weeks of my pregnancy. At that point, I did ask if I should be tracking movement. Was just told kind of like, yeah, if you want to. So I asked, how do I do it? Was given very vague information. And so I just assumed it must not be all that important. And even at that point, too, my instincts were saying this baby is safer on the outside than the in, and I requested to have a C-section. because I knew I would be delivered a week before her due date. So we scheduled a C-section. And unfortunately, when I did go in on November 2nd, it was for reduced movements. Before I went in, though, I did the drink something cold, lay on my side, the things that I was told to do before I went in. And so by the time I got to the hospital, there was traces of cardiac activity, and I was rushed into an emergency C-section. She was born with a double nuchal cord, so the cord was wrapped around her twice, her neck twice, very tightly, and was told that she had died within, the hour. And so I can't help but think if I had known, and I didn't waste time, drinking that cold water and eating something sugary, I could have gone straight to my provider and gone in right away. And so after she died, I made it my mission that I would do all that I could to give these resources to individuals who are expecting, or those that serve people who are pregnant, to be able to save a life. Just because I think 100% that Reese should be here if I had had better education and given the opportunity to save her life.
Thank you, Amanda. Sorry, couldn't get the mute button to come off there. I'm always highly impacted when I hear Reese's story from your word and from your words. And also, I think it's just really important to acknowledge, I use the word standardization, right? Standardizing how we're responding. That's a huge goal when we're talking to
Mhm.
hospitals, is we don't want them to hear that negative advice that delays care. And so I am so appreciative of you sharing your story with us today. So another person that contributed to this work, in addition to Amanda, who's on the call, and Amanda, we can absolutely, if you want to share something, we can absolutely allow you to talk today. But Tessa was mom to William, and she lives in Dayton, Minnesota. And, in her words here on the screen, what you see, she testified when they were moving forward with this bill. And she said, because I had educated myself and researched the importance of fetal movement and tracking, I knew something was wrong. But she also, and this is like, behind, right? So she's looking with that hindsight there. But William did not, he is not, excuse me, sorry. William's life may not have been here because of that. And so it's really important that we acknowledge these very real stories by people who are in Minnesota. And Amanda, I would absolutely love to let you talk. There you go. Let's see if that'll work.
Hi everyone, can you hear me?
We can. Thank you.
Wonderful. I'm Amanda Feltman and I live just outside the metro area. And my first daughter, as Sarah mentioned earlier, Juniper was also stillborn at full term, similar to Reese. Um, Unlike a lot of loss stories I feel like we hear, I was under close monitoring because Juniper was IUGR growth restricted. And before this experience, I felt like if you were being watched closely, you like knew something could go wrong, or like you had that feeling. And it was really the opposite for me. It felt like because I had so many ultrasounds that it felt like they were telling me nothing could go wrong. It felt like I got a lot of like, wow, we're watching you like too closely almost. And fetal movements were never mentioned to me other than like very like laissez-faire, like they would be taking off the monitors, call if movement changes. But like Amanda Duffy said, it did not sound important. And the day before Junie died, it was the last regularly scheduled MFM scan I had. She slowed down. I had 4 ultrasounds that week. No one had talked to me about how important that was. And same as Amanda Duffy did, drank some juice, drank some cold water, and decided to wait for my appointment. And so the next day at that last regularly scheduled growth ultrasound, we found out she had died. Her autopsy, placental report, everything showed she died about 24 hours before her delivery, possibly closer to 12 hours before. My appointment was at 8 a.m. that day, and she was delivered at 7:41 p.m. that night. So just so similar to Reese's story of such a close call, noticing that lack of movement and the importance of it being educated to us pregnant people by our doctors and, highlighting it as critical importance is what could have changed her outcome for sure. Thank you for letting
Yeah.
me share my story.
Absolutely. And we hold Juniper, we hold Reese in our hearts. We make space for that as we do the work in Minnesota. These stories are so important and critical. Um, so as you've heard from both Amanda Feltman and Amanda Duffy today, and also Senator Paugh, who have very different outcomes, right? Movement matters because this is the way babies communicate before birth. And this is really important that we're paying attention to early changes. We don't want the late changes because it might be too late. We want to pay attention to these early changes in pattern. So, how is it that we count the kicks? Let me share our steps. We'll break it down into 5 easy steps. And by the way, if you are somebody who works with expectant parents, you can use this QR code. I'm sure Carrie, who is joining us today to monitor the chat, will throw a link in the chat. This is very easy to share with patients and put into electronic health record system. So we have some links that we'll share with you today so you can follow along. So the first thing that we're going to do, if we're paying attention to baby's movements, so I have the nurse hat and the educator hat. The educator in me says, find the way that works for someone to count. We have our app, which is completely free and available in over 20 languages. It is a wonderful resource. We'll show you what it looks like when people are using the app to count. But we have folks that may not have access to a phone. They may not want to count on a phone. They may want to write it out. They may want an opportunity to count, as a tactile form of that. So figuring out what and how someone wants to count is really important. We are going to ask our expectant parents to count every single day. Every single day. So this has to happen during that third trimester every single day. We will also want people to pick a time when their baby is the most active. Now, research will tell us that's usually towards the end of the day, of course, when we're trying to relax. But what works for you to pay attention to your baby's movements? And so, as you're counting, you're going to use that system that you've picked. You're going to use either the app, the paper chart, you might use our wristbands, but you're going to time how long it takes that baby to get to 10 minutes, 10 movements, excuse me, 10 movements. And then you're going to rate the strength of baby's movements as well, because movement is not only the time that it takes, but also how it's happening. And we have a lot of stories that illustrate that the change was actually just, it went from really strong karate kicks to just flutters, and that was concerning. So, paying attention to that is really important. We're going to time how long it takes after a few days. So, step number 4, you're going to see what your normal looks like. So, you will be again to understand what that pattern is. Is it 12 minutes? Is it 26 minutes? Is it 40 minutes for you? I ran into somebody who was 4 minutes every day. She was 4 minutes every day. And I was like, well, that's lucky for you. She was like black and blue inside, but that was lucky for her. So it really, but I want to and just really emphasize that everyone's pattern is going to look differently. And also, what I'll say right here is that every pregnancy needs to be counted for. So just because you've done it with one pregnancy and you know how to do it, doesn't mean that you just are paying attention to it with subsequent pregnancies. That's a really important distinction. And I've seen that in OB triage when folks come in and they're like, well, it's baby number 5. I know that the baby is moving less. And I'm like, okay, but can you give me a range so that we can take a look at this and really understand what's going on with your baby? And they don't have that range. And then they become more and more anxious about that. Amanda?
Yes, Sarah, I was going to say too, with I can give, first hand account of that. I did not consistently track Reese's movements, but she was active. But then I started tracking her little brother's movements when I was pregnant with him. And if I would have could have compared both. He was very consistent with his movements, but he was a very lazy kid in utero. But I had that consistency and I had that in
Hmm.
my phone, so I could look back and see like, oh, this is normal. But if I'm comparing both of them, completely different.
Yeah.
Because I mean, they're not the same person. And so like Sarah was saying, you can't just assume that just because, your baby before moved a lot, this one's going to move a lot too, or vice versa. Everybody here on this call is different. Every baby is different as well.
And again, medical hack going on. Every pregnancy has a different impact on mom too. So that's something else to recognize and just be aware of, that this may be the baby, that there are some things going on with morbidities as we think about like diabetes or, cardiopathic things that are going on. So it is really important to count for every single baby. Thank you, Amanda, for underscoring that for us.
And I have one more thing to say too. I think
Yeah.
it's important if you're a provider or you're working with pregnant people, is when you are meeting them for their checkups, to say something, ask the question more of like, is baby moving? That's a yes or no question. When you're working with individuals, say, talk to me about the baby's movement patterns. Talk to me about, because that's implying that these pregnant people are paying attention to the movements and you're getting to know more about that baby. I did get asked, in those appointments with Reese, is baby moving? Well, yeah, but they move until they don't move. And so when you're asking
Yes.
these questions to your patients, be more open-ended with those questions. You're not going to I think the biggest misconception too is you're going to scare people if you talk about stillbirth. Like I would have loved to know about the risk of stillbirth before Reese was stillborn, and so I think having open dialogue is so, so important in these conversations.
Yeah. Oh, I so appreciate that and so agree. And also, someone just sent in a message to us. I'll just share what this says. As a provider, I think that we should also create scripts for providers when they're talking to their patients. Many are afraid to say, one of the ways in which we can prevent your baby from dying is by keeping track of the baby's movements. So a provider may be afraid to say the word dying out loud. And I absolutely believe that. So thank you for sending in that comment. And the secondary comment, which I absolutely agree on, is we scare pregnant people about everything else. And that is true. Now, I don't want us to go to scare tactics, but I want us to be very real about what is going on and understand that. If we're going to talk to people about the risk of heart disease during pregnancy, we should just be honest, just as honest with them about a way to pay attention to your baby and keep your baby healthy is paying attention to movements. And by the way, far less invasive and cost savings when we are paying attention to movement are, I mean, that's a different webinar. That's a different webinar that I could go into.
And I have one
Amanda,
more thing to say, Sarah.
you're
On
fine.
this vein of scaring pregnant people, I think as a provider, you have to give them all of the information, and then they get to decide whether they're going to be scared or not, and then ask you questions. But if you're withholding information from them because you're scared of how they're going to react, that's not providing adequate care.
Oh my
Off my
gosh, I love
soapbox.
that. I totally agree with that. Thank you, Amanda. Totally love that. So, just to recap, in all those things, what we want people to do when they notice a change in movement. So we've gone through our steps, we're paying attention every day. If someone notices that change in movement, what we want is people to get with their provider. And we need providers to have those conversations about what that looks like ahead of time. I'll put in a plug for that right here. If you know your patient has to drive 90 minutes to your hospital, what's the plan? Is the plan that you want them to start to you when they've noticed that change or they're concerned about something, because that's going to just get them closer to you if you're like, yep, I want you to be seen? What's the plan and how are we communicating that with patients is really important. In even thinking about that with folks that are in our urban areas, they may be reliant on someone else to get them to their provider who has to come home from work or has to get kids to daycare. There's just a lot of things going on. So, what does it mean to get to your provider? For us, we want you to physically get with your provider so that they can see you, because we've talked about how much the time involved is here. That just is something I want providers to be aware of and to really think through as a step with their patients. And some great comments in the chat around this. So, okay, let's see. Oh, look at that. My link is broke. Dang it. I was here to show you the app. My link is broken on this. So what I'll do is I'll just go over the app for you really quickly, but I invite you to use that link that Carrie shared with you in the chat to download it because what someone's going to see when they open this app is very, very easy to use. They'll click on the start counting button and then a footprint will show up in the middle of the app screen and there will be a circle around it. Each time mom feels that baby move, she is going to touch that footprint and that circle will fill up in a teal color. Once that circle is filled up, the timer will stop. Then there will be a screen that shows up and asks you to document what the strength of movement was, and there is a space for additional notes. So if someone has been experiencing hot temperatures, they're not drinking enough water, they know it, because a lot of times we know it, and they are just noticing some changes, that is a place where they can document those things that are happening. And what we saw last year in a neighboring state, Wisconsin, we had a doula reporting to us that a lot of expectant parents were coming into OB triage dehydrated and resulting in a lack of fetal movement or a change in fetal movement. And so the physicians were able to say, oh, look at the, it's the temperature, let's hydrate them, let's monitor them, and hopefully get them right back out on their merry way. But because these expectant parents had been trained by their doulas to write that kind of note there, it helped identify a potential problem much quicker for the physician. So, a great place to capture notes. So just a couple other things. It's not only Apple that the Count the Kicks app is on, it's also available on Android devices. We also need folks to register for this program so they can use it across platforms. So if one day you're using your phone to track, but then tomorrow you have to use your watch, your Apple Watch or your smartwatch to track, those can talk to one another if the app user is registered. Another benefit of registering is that folks can see longitudinal graphs. So something that I love to show here, and I apologize that I can't today, is you see a graph of your baby's movement. So, you'll have some variability maybe of 1 minute, but you'll see a constant pattern. Every day it's at 16 minutes, and you will see that constant pattern that's shown. That's a visual cue. It's also data that can be shared with a provider. So if you are on the way to the hospital with a concern and your provider says, "Hey, send me your Count the Kicks data. I want to take a look at your timing." That is something that can easily be shared from the app if someone's a registered user. And I just want to say we are not selling or sharing anybody's information. This is simply to make sure that patients can use this across platforms. So a lot of great tools that are buried within the apps. We also have the ability to access a contraction timer. If someone's using our printable kick charts, which we'll share a link for you and talk a little bit more about that coming up, they can actually be scanned to go right into the app. So that's a great feature. We have digital badges, so games to keep people active in this, but there's a whole bunch of features within our app. We are constantly working on things that make it more user-friendly and accessible for folks. Another thing that I want to highlight is our Ask Anna. So Ask Anna is our Excuse me, I have a frog in my throat. This is our AI feature that we introduced to the app last fall. And a huge benefit of Anna is that this is pulling information from our medical boards, articles that they have reviewed and said, this is where Anna needs to pull that evidence-based information for these talking points that come in. This does not take the place of the provider at all. There is a conversational tone. This can happen in different languages. So again, we have that language support. But an example of something that might get asked here, it's a huge misconception that we hear all the time is, why don't you count hiccups for movement? And we don't count hiccups because those are involuntary movements. Otherwise, and yes, we're known as Count the Kicks, but we're going to count those rolls, the jabs, we're going to count the hanging from the ribs feelings, those turnovers, kicks, elbows, whatever it is. We're going to count everything but a hiccup. And that is one of the most common questions that Ask Anna is seeing. So a great way to avoid the nurse TikTok and Dr. Google happening, and getting those misinformation into a pregnant person's hands. So Ask Anna is a great AI assistant. Another a feature that you can access within our app is our Find Help. So if you are looking in your community, if you're somebody who would like to know about education opportunities or diaper drives or community baby showers, maybe you're looking for dental care at free or reduced cost, you can take a look by zip code through the Find Help section of our app, and that's just available in the menu. That's a great tool. So let's turn our attention away from the app and those tools, and let's address just in the time that we have left, I want to address two misconceptions that we hear very often. This goes to that standardization comment. And then we're going to tell you about the resources that are available in Minnesota for you to access completely free. So our first misconception, and I learned this in nursing school in the very late 90s, was baby should always get 10 kicks in 2 hours. And guess what? I still hear this today, even though research has debunked this. There are numerous papers that show that as medical professionals are treating pregnant patients, those pregnant patients need to be treated individually. And so, therefore, their movements need to be monitored for each baby, and each baby will have its own window. So, that may look like 8 minutes, it may look like 26 minutes. Everybody's baby is different. And this is why I go back and say, and every baby is different for that mom. So we need to instruct pregnant patients to understand what their normal is for that baby. So this is a misconception, right? Probably one of the most common ones that I hear. The second one, and this really goes to some of those the community support systems that just don't have accurate information. You heard it from Amanda and Amanda here, that people get told, "Oh, you're probably okay. Just, wake your baby up by drinking Dr. Pepper or eating a candy bar or go lay down." Or one thing that we heard recently was go put ice on your belly. Like, what? Like, no. And here's the science behind this. This is why we don't want that to happen. When we change the variables that are around that baby every single day when we're counting, we that's why we say choose the same time every day. We want to standardize those kick counts. We want to know that the same thing is happening. And when we introduce sugar, when we change those glucose levels, yeah, we may have an impact on baby, but we're then masking what might be wrong with baby for just a short time. And so it's really important that we do not mask what is normally occurring. We do not want people to eat something sugary. We do not want them to drink something. We do not want them to force baby to move, because that is not an accurate representation. So just want to be very, very clear that these are two of the biggest myths that we encounter. This one we often encounter from providers that just don't have the most recent data at hand when we're talking about movement. So, and if there's any questions about those misconceptions, or if there's a misconception you have heard that you would like us to address, I'm happy to do that here today. If I don't know the answer, I will research it and I will get back to you.
Sarah, I was also going to say too, for that
Yeah.
misconception of eating something cold or sugary and masking, it's no different than if somebody has influenza, they're running a fever and they take ibuprofen, that fever is lessened, but that doesn't mean that you don't have influenza anymore. You still have
Right.
that influenza. It's just the fever is masked because of the medication. And I think something to really hone into as well is there's this misconception too that if we're going to be talking about this to our patients, that's going to make them really anxious, and that's going to make them come in more often, and that's going to make us have so much more work. And I don't know. I mean, I don't know about the rest of you, but for me, more information actually allows me to feel more settled and secure in the decisions that I'm making. Less information makes me then start to question and my anxiety go up. So if you're working with individuals and you're hesitant to bring this information up because you're worried that it's going to make them come in to see you more often, I would say that is not my experience.
And that does not bear out in research, just to be
Mm-mm.
clear. So Amanda's absolutely right. It does not bear out in research. We have studied, we have looked for this to show an increase in patients presenting to an ER because they're counting fetal movement. It does not exist. We also, to Amanda's point, we have some data. We have another couple of research studies that have been published that show, and it's not an emphasis of our presentation today, but it's absolutely true. Individuals do not experience more anxiety because they're counting. When we survey our app users that have ended, their pregnancy is over, they get an opportunity to communicate with us about how their experience was. One of the questions we asked is, did you feel more anxious because you were paying attention to baby's movements? And overwhelmingly, people responded that they were not more anxious. Just to Amanda Duffy's point, that they felt better about being informed about their baby every single day. So thank you, Amanda, for bringing that up. That's really important. Amanda, would you like to tell everybody what's available in Minnesota?
Sure. So, if you are a Minnesota resident, we have resources that are available to you for free, and that's thanks to the hard work of Senator Pa and some Minnesota individuals here to get funding for the state. And we want you all to have access to them. Order the resources, share them with your friends, share them on social media, give them to your patients. And so we've got posters if you work in a hospital or clinic with QR codes to access the free app or the paper counting tools and more information about how to effectively count those fetal movements. And that information comes in English and Spanish. We also have wristbands. So if you are working with individuals that maybe, like Sarah said, don't want to use an app, download that. There are wristbands that are available that you can track count or kicks using that wristband or with a paper copy. But again, these resources are free for you. So we want you to order those materials. Order more than you think you might need. It's a really great starting point for individuals that are either pregnant or thinking about even getting pregnant, just to start to have more conversations.
Yeah, absolutely. And our materials are being made free in part with the work that Senator Pa laid that groundwork for the Minnesota Department of Health to be our partner in providing these opportunities and resources for. So we're very grateful for that support. And for Senator Pa, thank you again for passing the legislation that made this funding possible. Very grateful for that. And then I also wanted to share with you our at a glance material. So if you're wondering like what's the difference, our at a glance materials are more picture based. They're easier for someone to see and make sense of the message very quickly. I'm not picking on Gen Z, but Gen Z really likes our at a glance materials. Whereas our traditional has a little bit more information on them for folks to take a look at. So that's just an example of some of the materials that are there. And then also badge reels. Senator Paul, is it okay if I pull out your comment and put it into the chat? Is that okay? Okay. Badge reels are also available, but you need to connect with Amanda on that. So Amanda Duffy, if you would throw your email in the chat. So our badge reels are awesome. They have a badge buddy that comes with them, as you can see in the picture, that shares our 5 steps on the back, and then you can flip it over for the QR code. One tip, nurses, all the nurses and providers in the room, the badge buddy is awesome to zip tie to the blood pressure cart. So as you're wheeling that around to different patients, they can see that, and you can wipe it down with those wipes that we use to clean things in the hospital. So you can sterilize it, or sterile. It's probably not sterile, but it's cleaned when you move it from room to room, or you can zip tie it to other places. But it's just a great tool to have at your hands when you're talking about the Count the Kicks apps. And like Amanda said, we're going to use open-ended questions to talk about Count the Kicks with our patients so that they really understand how important this is. So I mentioned the wristbands, and Amanda Duffy mentioned the wristbands. This is just a look at what they are, just a little bit closer. They come with a patient education card on them to explain exactly what those steps are. But this is made out of that same material that like an Apple Watch has. And there is a slider, as you can see where her thumb and forefinger are meeting, there's a slider that band is numbered 1 through 10. There's an impression of those numbers there. And so every time mom feels that baby kick, she can just move that across. So all she needs to pay attention to is what time did I start? And what time did I stop? And by the way, if she's tracking every single day at the same time, she doesn't even need to pay attention to that. She just knows, oh, 5:10, time for me to count. 5:23, time for me to end. That took 13 minutes, right? So this is a great tool. We've also talked a little bit today about our downloadable printable kick charts, and I believe Carrie has thrown a link in the chat for those as well. There are 18 languages available. And so this is a great resource, again, that you can print off and have at hand. For folks, WIC clinics love to have these printable kick charts in their patient education folder. We've seen high increase in engagement there. Just a few more opportunities, and then we will pause and answer any questions that you have or take your feedback. If you are very interested in kind of the more research side of this, like what is Count the Kicks based on, we have the opportunity in Minnesota to provide you with a free CE training. This will take you about 3 hours to accomplish. You will receive 3 CEs. You can register. Again, I'll share this out with you after today on the slide deck. You can go register with DMU for your CEUs. I'm sorry, your CEs, and then you use the code SAVEBABIES-MN to take that training completely for free. So if you are somebody who really likes the research weeds and want to get in there and know some more, there's some tips about working with communities also in there. There's a whole lot of information there. We also just want to share a plug for it again. If you would like to share our resources digitally, you can go to a link that is provided in your follow-up email. You could scan this QR code, register, and you would have the ability to share this resource far and wide. And then another team member that I have on the call today, Nia Thomas, is the author of our resource guide for doulas. So those of you who work with doulas, if you're a doula yourself, we have a specific guide that includes some tips and information for doulas who are working with clients to teach them about Count the Kicks. There's such a special, unique relationship that doulas have with their clients. Teaching opportunities are there. There's role-playing exercises that are lifted up because it can be really scary to talk about, to question, to ask your doctor about fetal movement. Why aren't you talking to me about this? Or how do I share that I'm really concerned about this movement? And is it normal? There's role-playing there for those safe spaces that doulas have with their clients. So I think, yeah, my links are broken and I do apologize. We'll make sure you have these links in the chat today. We have shared a lot of information with you today. I've been so pleased to be joined by 3 women who are lifting up their stories and lifting up our messaging. I'm so grateful to have them here with us today. At this time, we are happy to answer any questions that you might have about Count the Kicks. If there's anything that you would like us to know about your experience with that, we would be happy to listen to that.